You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. Hello, everyone. I am super excited to dive into hormones with my guest, Dr. Kyrin Dunston, board-certified OBGYN, who practiced conventional obstetrics and gynecology for 20 years until she had her own health challenges, which included chronic fatigue and fibromyalgia, along with other things that she'll get into. Dr. Kyrin has her own podcast called Her Brilliant Health Radio, and she's got a tagline I love, that she used to deliver babies, and now she delivers exceptional wellness for women. And it's not a moment too soon. We have a world of women in perimenopause and menopause who are experiencing sometimes debilitating symptoms like profound fatigue, poor sleep, weight gain, weight loss resistance, hair loss, night sweats. Sound familiar? Anxiety, depression, and low sex drive. And when you add autoimmunity into that mix, it's just a volatile equation. And most women are told, this is normal. You're just getting older. Or there's a pill for this and a pill for that. But we know that medications are often just Band-Aids for symptoms. And over time, they present their own, quote, side effects, which are not really side effects at all, but direct effects of the medications, which include autoimmunity and cancer. So welcome, Dr. Kyrin. It is such a pleasure to have you here with me.
Thank you so much for having me, Palmer.
It's an honor. You have such a powerful story about your own path of finding functional medicine and going from the conventional world of OBGYN into practicing a more, let's call it comprehensive medicine called functional medicine. It's a story that so many people in my audience are going to relate to. Could you start with your own story?
Sure, I'd be happy to. So I was a very successful OBGYN, delivered thousands of babies, did pap smears, hysterectomies, loved doing it. I had a very successful practice. At one point, we had 4 physicians. We had mid-level providers, 31 staff members. I was married. I had 2 kids. We lived in a gated community. And so from the outside, I looked like I had it all. But the one thing I didn't have was my health, because you could look at me and see something was wrong. At my worst, I weighed 243 pounds. And I also had daily pain in my body, something called fibromyalgia. I was tired all the time. So I had something called chronic fatigue, where basically I worked and I slept. I had depression, anxiety. At one point, I was on 5 different psychoactive medications to treat that. My hair was falling out. I had no sex drive, and I looked and felt 20 years older than I was. And I just was existing, and I was going to work and putting one foot in front of the other, but then I would come home and just be exhausted and think, where am I in my life? Like, who am I and what happened to me? And I actually got to a very hopeless and depressed place, because here I am, board certified OBGYN. I know the tests to do. I would run them. They'd all come back normal. I'd go to my internal medicine doctor. I'd say, something's wrong. Look at me. She would run tests. They would come back normal. So after a couple of years of this, finally she said, Kyrin, listen, stop. Stop coming to me. Nothing's wrong with you. Your tests are all normal. And I remember going home from that visit and just feeling so dejected and hopeless. Like, I know everything there is to know about women's health. I can't figure out what's wrong with me. Everyone says there's nothing wrong with me, but I feel like I'm dying. And I really didn't have a choice except to keep living my life and doing my job. And then one day, a patient I had been working with who was at midlife like I was, same types of problems, crazy, heavy, irregular periods, couldn't sleep or was too tired, depression. She had skin problems, irritable bowel. That was another thing I had, and gastritis. So all the same crazy midlife stuff that we all get, right? And if you're listening, you know what I'm talking about. And I did the usual board certified OBGYN treatments. Oh, birth control pills, antidepressant, sleeping pill, something for your heartburn, right? All the usual. She gave her a fistful of prescriptions because that's what I was taught to do. She went away, didn't come back for like a year. And then she came back. And I saw her at the end of the hall. And I knew something was different. She had lost like 30 pounds. Her skin was shining. Her eyes were bright. She looked 10 years younger. I immediately ran up to her and I said, "What did you do?" And she said, "Well, I went to this doctor who practices this thing called functional medicine." And I'm like, "What is that?" Because I had never heard of it. And anyway, she learned about it from a book by Suzanne Summers, and she brought the book for me. And I took it home and I put it on my nightstand, and I was married at the time. And I said to my husband, "I'm not going to read that book. It's by Chrissy on Three's Company." And he said, "Well, yeah. And she used to be a Playboy bunny." And I was like, "I'm definitely not reading that book. I'm a board certified gynecologist. What's she going to teach me about women's health?" Anyway, fast forward a few months, it's sitting on my nightstand. It was a Saturday, and I was always in bed when I wasn't working in my pajamas, right? Within 5 minutes of hitting the door, clothes off, pajamas on, in the bed. And my kids came in to say, "We're going to go to the movies. We'll be back." They didn't even bother asking me anymore if I was going to go because they knew the answer would always be no. So they just peeked in. "We're going to the movies. We'll be back." So I said, "Let me just pick up the book and look at it so I can give it back to her on Monday and take it off my to-do list and tell her, 'Thank you very much. I looked at it.'" And the most incredible thing happened. I started reading it, and it wasn't Chrissy's from Three's Company opinion on anything. She was just using her celebrity as a vehicle to bring information from these doctors and scientists she was interviewing in this thing called functional medicine. So immediately that grabbed my attention, and everything that they were sharing in there made complete sense because it harkened back to the biochemistry and physiology of how the body functions that I learned in medical school. Then I went to residency and they told me, "Don't worry about any of that. Just do what I do because this is how we do it. Give this birth control pill because that's what we do. That doesn't work, give another one. That doesn't work, give a hysterectomy. Can't sleep, give a sleeping pill. They're not happy, give an antidepressant," right? Just do what I do. Don't worry about how the body works. So this book reawakened all what I had learned in medical school. How the body makes energy, how the hormones function, how nutrition plays a role in all of this, how toxicity interferes with your body making energy. And then she had a great resource section. Anyway, in one day, I didn't put the book down. I was reading it like the Da Vinci Code. And by the end of that, I had something I hadn't had in years, which was hope. Oh my gosh, what if I don't know everything about women's health? Oh my gosh, what if this is true? Then there's hope for me. I don't have to live as an obese, depressed, in pain, tired woman anymore. Oh my gosh. And all made sense because they spoke to what I already knew. They just reawakened it. So I made the decision right there. I am going to learn everything I can about functional medicine. I'm going to do the tests. I'm going to learn about supplements, nutrients, micronutrients, macronutrients, other nutrients your body needs, hormones. And I actually started working with a naturopathic physician, and we did the tests. And guess what, Palmer? What? When I did the right tests and I read them the right way, oh my gosh, they're abnormal. Wow. I didn't know I wasn't doing the right tests and I wasn't reading them the right way. So my thyroid, I had checked my thyroid at least 10 times. Normal is what I was told. Mainstream. When I did the right tests for my thyroid, 8 different tests, And I didn't look for normal because that's what 95% of the population has. I looked for optimal function, which is what you want. I don't know about you. I want to be optimal. Like a well-tuned Ferrari. I don't want to be a clunker, that's getting ready to go to the junkyard, which is normal, right? That's what happens to us. If we're normal, we age, we get tired, we lose our sex drive, we lose our hair. This is the norm in our society. Well, if you don't want that, you got to go for optimal. So when I looked at optimal, guess what? I was hypothyroid. I was progesterone deficient. Well, progesterone is the weight gain, diuretic, anti-anxiety, anti-depression, feel-good, happy hormone. And I didn't have enough. I was testosterone deficient. That's your get up and go drive mojo hormone. Didn't have enough of that. Had way too much estrogen, which is your PMS, heavy, painful period. Kind of, you need enough of it, but when you have too much, you kind of feel PMSy all the time, right? Mm-hmm. So I had all these hormone imbalances. I was vitamin D deficient. Anyway, I started using natural treatments, natural hormones, vitamins, minerals, working with my lifestyle. And oh my gosh, I started having energy, less pain. So my whole journey, Palmer, was like 2 years. I started going to functional medicine conferences. I joined the fellowship in anti-aging, metabolic, and functional medicine. I would go to these conferences, learn about a test, food sensitivity testing, functional stool testing, heavy metal testing. You name it, I was my own guinea pig. I do the tests, I address the problems. And all of a sudden, the weight just started coming off. My energy started coming up. My hair started growing back. Depression, anxiety, gone off all psychoactive medications. Off, I had been on sleeping pills sometimes because I couldn't sleep, off all that. And so, of course, my patients who are middle-aged women with the same problems, they start reacting to me like I reacted to my patient. What are you doing?
I'll have what she's having.
I want that.
I want that.
So I started doing the work with them. And they started having the same results. And so I kind of did this straddling the fence thing where I was doing my OBGYN practice and I was doing my functional practice. But there's a big difference. So regular medicine takes minutes. Here's your prescription, right? Oh, heavy painful periods, birth control pill prescription, 5 minutes, right? Functional visits, no, a lot of talking, what's going on in your life. What stressors do you have? There's so much education. I need to educate people on the difference between normal and optimal lab values. Right. I need to educate them about functional testing and why don't we use this in mainstream medicine, and root causes and nutrients, micronutrients, macronutrients, hormones. So it's an hour appointment or 2 sometimes, right? Mm-hmm. So the straddling the fence started to be very stressful for me. I'd be in the OR doing hysterectomies and my PA is needing me and she's knocking on the door and I'm in there for an hour talking about hormones. And she's like, what? We need you. So I, in July of 2011, I finally said, I can't give drugs and do surgery anymore. I can't do it. I'm not in integrity. I know this is not how to heal the body. It doesn't heal anything. These are Band-Aids, and we are doing women a disservice by treating them that way. I don't want to go so far as to say that some of those tools aren't necessary. I do prescribe medications, and sometimes you need surgery, right? And I'm grateful that I have the capacity to prescribe those if needed. However, healing occurs in this space that is infinite before you need those. And that's where we really need to be focusing our energy as healers of women. And so I retired from OBGYN. That was 9 years ago. And I've done this full time since.
What a fantastic story. And I love that it's a personal story, that you go from the pain to purpose. And I think people that have gone through this, their own trials and tribulations, and have had to figure it out for themselves, are often the most powerful because you've been there. You know what it's like to be on the other side of a prescription pad. You were the one giving out the prescriptions, right? My OBGYN told me for painful periods and I got like 3 or 4 a year, and they were so debilitating that she said, you need to go on birth control, and you can stay on birth control until menopause. Or if you want to have a baby, then you can go off. There's nothing normal about that, right? There's nothing normal about it. So I'm so glad that you're raising this point about the difference between conventional medicine, which has its time and place, as you know, as you spoke to beautifully, and functional medicine, which is root cause medicine. And I have found in my own experience of recovering completely from MS, we heal at the root cause level. We don't heal from medications that are just addressing symptoms, and sometimes not very well. And then you have to take another pill for a particular symptom, and so on and so on. I find that it's just a matter of really spreading the word, educating people so that, as Oprah says, when you know better, you do better, right? There's no blame here that people are getting themselves into these problems, but now we know so much more, right?
So true, Palmer. And there is a time and a place for medication, surgery, emergency medicine. My mom was recently visiting, and she's 85. She has severe osteoporosis. She tripped and fell. Her wrist snapped like a toothpick. She snapped her pelvis, her pubic bone. And do we want emergency medicine at that time? Yes, we do. Do we want pain medication?
Yeah.
Right, we do.
Yes, absolutely.
And yet, fast forward 20, 30, 40, 50 years, I wonder what could have happened if my mother had had access to this type of care, because someone could have prevented her from having bones that are so thin, they're like dust, that she breaks bones just by tripping and falling. Right? So that's what we're talking about. Why are we waiting till women have osteoporosis and then trying to back the horse out of the barn with medications that build unhealthy bone and cause problems? Why aren't we looking at bone density decades before, assessing when it's low, and looking at, the conditions that cause bone to start breaking down and fixing it?
That's right.
Which is too much cortisol, stress problems. It's an acidotic state. So then your body doesn't have enough calcium and it's leaching it, right? Why aren't we doing that? So this is the opportunity that functional medicine provides. And that's why I'm just so grateful to have had gone through the journey that I went through, because now I know this and I can really help women to heal with my ginormous toolbox,
Oh, it is so beautiful. And again, I just think having this story and having come from this and experienced both sides of the fence makes you that much more powerful, because you have access to all sides of the toolbox, right? Yeah. But it's about working as far upstream as possible. And maybe you can give an example of diabetes and how Western medicine looks at diabetes versus functional medicine, because people go and they get lab work and they're very familiar with this, right? You go and get your fasting blood work done at maybe 8 a.m. and they test your glucose. And what happens from a conventional versus functional medicine when it comes to glucose and diabetes?
That's one of my favorite examples, Palmer, of the difference between a mainstream approach and a functional root cause approach. So in mainstream medicine, you'll typically get annual blood work. One of the things that they'll do is a fasting blood glucose as part of a chemical panel. So you'll have blood drawn, like you said, before you've had anything to eat or drink, and that looks at your main fuel source, which is glucose or sugar, the level in your blood. And the lab says that it's normal generally up till 99. But in functional medicine, we know that if you are over 85, every point you are over 85 increases your risk of being diagnosed with diabetes by 6% in the next 10 years. That means that if you're at 99, you're 14 points over 85. 6 times 14 is, 60, 70, 84. 84% chance you're going to have diabetes diagnosis within the next 10 years. And I see people all the time who say, oh, my doctor said I have a little touch of sugar and they're going to watch it. They're going to recheck it next year. And so what you are on when you are in the normal range, but not in the optimal range for your fasting blood glucose, is the road to diabetes. That's what I call it.
That's right.
And you are walking down that road to diabetes. And you know what? All your doctors are just watching you walk down.
Watching
and they're
ya.
going, we see ya. We're not going to do anything.
Nothing
We're
at
just
all.
going to watch you walk. And then you walk. And then what happens? 5 years later, 7, 10 years later, they go, oh my God, now you have diabetes.
126, is that something like when they start giving you medication?
Yeah, it depends on, what tests they're using. It could be 120, 126, 140. Yeah. I find there's a lot of variability with doctors, but around that range.
Right.
Now you got diabetes. You get the team jersey, and they tell you you're going to have it for the rest of your life. You got to stick your finger and check your blood sugars. You're going to be on oral hypoglycemic agents to bring your blood sugar down, or you're going to do insulin shots once enough of your islet cells in your pancreas have blown out that you don't even have any. You're going to be on insulin. You're going to eat the standard American diet, American Diabetic Association diet, for diabetes, which really is not sufficient because it still has so much sugar in it. That sticky sugar is inflammatory. And so what it means is you have too much of it in your body. Well, it's sticking to all your cells. Just like if I put a sticky bun on your blouse, it ruins your blouse. Well, that's heated sugar. If you eat that sticky bun, that heated sugar goes through your bloodstream and goes on all your cells. So imagine sticky bun on your blouse, sticky bun in your eyes, sticking on the eyes, cells in your eyes, sticky bun in your brain, sticking on the cells in your brain, sticky bun on your heart arteries, sticking there and clogging up the fats, right? Mm-hmm. Sticky sugar sticking on all your cells and damaging them, right? This is what causes death, is inflammation by sticky sugar. And now let's go to a functional medicine approach. We look not only at your fasting blood sugar, but we don't want normal, we want optimal, right, Palmer?
Yes, we do.
So we want it less than 85 for sure. And guess what? If it's not less than 85, we are not going to watch you walk down that road to diabetes. We are going to sound the alarms, and we are going to educate you about where you are headed and what's going on in your body. And we are going to give you tools to turn around and walk back to where you came from.
That's right. That's right.
So
Beautiful.
you can go back home to your healthy self. But I think, a lot of doctors in mainstream medicine, their argument is, well, they're not going to change how they eat. They're not going to change how they live. They're not going to change their lifestyle. BS. I have not found a person yet who I didn't sit them down and have a good talk and say, listen, this is the road you're on. Yeah. This is where you're going. And this is what we're going to do to turn you around. Would you like to do that? Who hasn't said, hell yeah, excuse me. Hell yeah, I want to do that.
Yeah.
Take me, show me, right? We underestimate people's capacity and willingness to do what's in their best interest when given the proper information and education and tools. I have never found a person who said, no, I don't want that. I'm going to keep going down the road. Okay, so functional medicine, we're going to look at your fasting glucose. We're also generally going to look at your fasting insulin level, which is the hormone that keeps your glucose from going too high. And we're going to look at something called the hemoglobin A1C, which is a measure of how many of your red blood cells, the cells that carry oxygen in your body, have sticky sugar on them. So just like sticky sugar is sticking on all your cells, it's sticking on your red blood cells. So that's a way we can know how much sticky sugar have you had in your body over the past 3 months. And this is how they measure diabetic control, right? So we'll measure a hemoglobin A1C. In mainstream medicine, we don't check a hemoglobin A1C or fasting insulin until you become diabetic generally. But in functional medicine, if we want to go for optimal, we want to check it and we want to get your A1C down to less than 5 to 5.2. 5.2 is kind of my max for optimal health. Now, they don't consider you pre-diabetic till you're at like 5.7 and then diabetic up to over 6.2, 6.4, something like that. But my question is, why wait? Why do we want to watch you walk from 5 hemoglobin A1C up to 5.7, 6, 6.4, 8, 10, 13, 15. I've seen them that high.
Wow.
Why would we want to not intervene early? So in functional medicine, we intervene early. And we know that insulin hormone and your sugar affect all your other hormones, right? So if your insulin hormone's off and you're on what I call the blood sugar roller coaster, up and down, blood sugar up, blood sugar down, blood sugar up, blood sugar down, sticky sugar everywhere, inflaming things, right? It affects your thyroid. Read that as feeling cold, low body temperature, hair loss, skin problems, constipation,
weight gain,
fatigue, weight gain. Thyroid can't function optimally. Insulin hormone off, pulls off cortisol hormone, your stress hormone, right? That determines how your immune system functions, which has been highlighted with COVID, right? Everybody's worried. How do I get my immune system functioning better? Well, you get off the road to diabetes. When you're on the road to diabetes, your immune system's like, hey, I can't handle all of what you're handling with this sugar. It's pulling your cortisol off and your immune system function is going down. It's pulling your sex hormones off. Read as heavy, painful periods, infertility, PMS, decreased sex drive, right? So who knew, most people don't know, that what you put in your mouth affects all of your hormones, all of them, directly. So we don't associate that, oh, my period is heavy and painful and I have PMS because of what I'm eating and I'm on the road to diabetes. Although you might be early on the road, it doesn't take much. I see young women even sometimes, and their A1C is like 5.5, 5.6. Even that small shift is enough to give them heavy, painful periods or infertility. They don't realize it. And Palmer, these imbalances just start growing and feeding off each other as we age and we don't address the problems. And then here comes perimenopause and menopause, and the sex hormones start going down because your eggs, you don't really have as many, and they are older and they don't have good hormone production. And we want to blame it all on that. We want to say, oh, it's menopause. Oh, it's all menopause's fault.
And it's
right?
normal.
And it's normal, right? We say that. But the reason why, there's some countries where they don't even have a word for menopause because it's not a thing, right? I think it's Japan. It's not a thing. There's no pathology. You go through that phase and it's just natural, right? And so the reason why we have what we sometimes call pathologic menopause, where women are like, oh my gosh, it's a dumpster fire. What happened to my life and my body is because we have all these imbalances we haven't addressed. And we didn't even get to toxicities, nutritional deficiencies, all this stuff, right? And it's accruing, and we kind of put it off, right? Because we just medicate everything. Oh, I got a headache, I need a Tylenol. Oh, my stomach, I got indigestion, I just need an indigestion medication. Oh, I can't poop every day, I just need a little laxative, right? We just medicate, or, oh, I'm not so happy, I drink red wine every day when I come home from work. That was me, right? Because I didn't feel good. So I wanted to medicate. We're just medicating ourselves left and right. Until then we get to a point and it's like that stuff stops working. And we're in that dumpster fire. We're like, what happened? And so a functional medicine approach looks at, are you on the road to diabetes? Are you there? We give you a big wake-up call. We turn you around. You go back. And, that's the big difference.
So beautifully described. And I think the holy grail is prevention, but that's not always where people are focused, because let's face it, we're all busy. We're all on a mission in our lives. A lot of people have kids, they've got work, they're just juggling lots, aging parents and so forth. So I have found in my experience that it's symptoms that are driving the seeking, right? So symptoms, as I talk about with my peeps, autoimmunity happens on a spectrum. It starts silently when antibodies start brewing, okay? Which is a sign that there is inflammation going on someplace in the body, And I use the acronym FIGHTS for food, infections, gut health, hormone balance, toxins, and stress. So it's some combination of FIGHTS factors. And if those are unaddressed because you're not working with a functional medicine or naturopathic doctor, over time, and it could be decades, it becomes autoimmune expression. And that's the beginning of symptoms. And if left unattended for long enough, the spectrum becomes full-blown autoimmune disease and tissue damage potential. So that's the spectrum. So when we're talking about functional medicine in the context of autoimmunity, what a fantastic opportunity to address it when it's silently brewing, or let's not even allow it to silently brew. But I'm finding that here we are right in the middle, that people are looking for solutions when they start feeling bad. So let's start talking about symptoms, if you don't mind, because I find that more and more people are experiencing these mounting symptoms, and then they really want answers. And that's when they're willing to make those changes. Because a lot of time, putting down that proverbial sticky bun, whatever it is, when you don't feel bad, you don't have any reason to. But once you start experiencing hair loss, and I'm seeing more and more women, clients of mine with hair loss that are freaked out, once you start not being able to lose weight, and that's men and women, or you put on the pounds and you just can't get rid of them. They are so tired, profound fatigue during the day, but can't sleep through the night. So can you talk to us a little bit about those symptoms as invitations to dig deeper? And if somebody, maybe we can paint a picture of like the typical woman, she's in her 40s or 50s and she's got, D, all of the above, and she finds you, How do you think about that? How do you think about what test to order? What order do you do things with her? Any way you want to go.
Yeah. So I love that question. And, the age of 47 comes to mind because that's the age that I started my journey. And really, I was at my tipping point. The symptoms were just mounting and I was hopeless. And I actually, before we got on our podcast interview, was doing a complimentary discovery session with a woman who reached out to me. She heard me on someone's podcast. And similar situation. She's like, I've had a surgery every year for the past 8 years, and I've gained 30 pounds in the past 2 years, and I'm just tired all the time, and all the things you just described. So I think it's a great opportunity to really talk about that. And I think the first thing that I like people to understand when they reach out to me like that, to do just a quick phone conversation about, can you help me, is I like to kind of get A to Z, what are all the issues you've been having? Because we tend to minimize and also be in some type of denial about all the issues we're having. Like for me, if you had asked me before I found functional medicine, what was my biggest concern? The weight. Because everyone could see that I was obese. And as women, particularly, it really hits to it's the thing that people can see that I'm out of control because my weight is so high. And so I had tried diet pills and prepackaged foods and exercising like crazy. I had tried all those things because I just wanted to lose the weight. And I thought the weight was the problem. And so we really have a disordered kind of patterning in our brain as to what actually creates health and what the issue is. So we are really trained in our culture to do symptom treatment. So I thought the weight was the reason I was tired. I thought the weight was the reason that I was losing my hair. I thought the weight was the reason why I had all these problems. If I could just lose the weight, then I wouldn't have these problems. And that meant that I minimized a lot of the other symptoms that I thought were totally unrelated. Like I had really bad gastritis at one point. They did an upper endoscopy and had me on H2 blockers, and I had horrible irritable bowel. I'd have loose stool for 3 days, and then I wouldn't poop for 4 days. And, it was just this constant turmoil, bloating. I didn't relate that to anything of these other problems. So I think, what I love for people to get and everybody watching is you really need to do an inventory of all your systems. And this is one of the first things I have people do. All of the symptoms that you are having, all the surgeries that you've had, all the diagnoses you've had, all the medications you took previously and are on now, guess what? They're all related, and they're all conspiring in this body called you to give you your current health and your current symptoms. Every symptom you're having is related, right? So that's what I love to help people see. And then it's not because you're overweight that you have these symptoms, right? It's not just because you're low thyroid that you have all these symptoms. It's everything that's the picture of you, right? It's not, if you think about, if you see a picture of someone you consider attractive, it's not just their hair or just their eyes or their clothing. It's the whole picture. And it's the same with your health. It's all of that. So that's the first thing that I like people to get. And then I really like them to understand what we talked about previously, Palmer, which is the difference between, I say, now I know you're used to an allopathic way, a Newtonian way of looking at your health, right? That you are just this physical body and that there's gravity and mechanical action that create things, and that there's a symptom, hammer, get rid of it, right? That's the goal. And then I help them understand the difference between that and a functional approach. I talk about the tree, right? The functional tree.
Of course.
And I talk about how in mainstream medicine, we're up in the leaves and branches. You go to the gastroenterologist when you have gastritis and irritable bowel, and they give you drugs to get rid of the symptom, or they do an endoscopy to see the anatomic defect, or they do surgery, right? You go to the dermatologist. If you have a skin problem, they give you a cream to put on to get rid of it, usually a steroid. You have depression, you go to the psychiatrist, they give you a medication to change your neurotransmitters, right? So they're all up in the branches doing their little part. But if you go down the tree in functional medicine to the roots, all those leaf problems, guess what? They all have the same root causes. And I break them down into 4 main categories: nervous system and hormone imbalance, which for me is communication. Your hormones and your nervous system are what tell the cells in your body how to function. Well, what happens when you don't have proper communication, right? So I like to use the idea of a hurricane. When there's a hurricane in an area, after the hurricane's gone, what has to happen to restore functionality to that area? You got to get the communication back up. The phone lines and the roads have to be open so people can get in and get information in. They can get debris and take it out and get information out. We have to know how many people are injured. What kind of help do they need? Let's get them the help. Communication is everything. So without communication in your body, when that shuts down, when your hormones are out of balance, your nervous system isn't communicating. Cells don't know what to do. They can't function right. They can't make energy right. They can't detox right. And you have all these autonomous cells just doing the best they can to function. So you got to get that root cause right. Then you got to look at toxicities. And there can be internal toxicities, external toxicities. They can be infectious, so viral, mold, parasitic, bacterial. They can be chemical, heavy metals, pesticides, all of the myriad chemicals that we come in contact with. It can be energetic toxicity, electromagnetic frequencies, right? So we got to get those out. And then you got your nutritional deficiencies, which majority of us, 79 to 90% of us in America, are deficient in specific micronutrients that we need not only for proper communication with hormones and nervous system, but also for our building blocks and to make energy, ATP in our cells, for us to make neurotransmitters and bat an eyelash and think a thought and digest our food. And so we've got to look at that. And then we've got the piece that I love, which is the mental, emotional, spiritual balance, which those are the intangibles that even sometimes we can miss in functional medicine, right? We think we can oftentimes take a very mechanistic view of the body and try to move everything with supplements and detoxing. And the truth is that you have this thing called an energy body that's much more subtle and is just energy currents or chi or prana or whatever you want to call it that flows throughout the body, that is measurable with certain instruments and can be accessed in certain ways, like with homeopathy, like with acupuncture, these meridian flows. And it has to do with the intangibles, your thoughts, your feelings, your beliefs, your connection to something greater than you, your purpose in life. Are you on purpose? Are you fulfilling your purpose? And so that's a big part of the inputs too. So when someone has dis-ease in the body, I always help them to see that this is a call to a larger expression of those intangibles and a larger expression of who they were meant to be in life. And somehow they're not fully fulfilling that. And disease is a call to, hey, wake up.
That's right.
Not only do you need to look at your hormones and your toxicity and all that, but there's something you need to get about the business of doing that your soul came to this earth to do, that you need to get about doing. And so that's kind of my framework, which is a wholly different framework, Palmer, from the one I started with. Yeah. But, you know, I believe for those of us who do this work, including you, we are healers. And, you know, I thought before I went to medical school that the goal was to become a doctor and then I would know everything there was about healing. But what I learned was that was just one piece of my journey and the puzzle. And that I'm here to have my own health journey, to learn these truths, if you will, and garner these tools to be able to share them with women so that others don't have to suffer.
That's so beautiful. And the fact that you're standing in front of this painting that you did, I believe, that you look like this angel with this halo, or it's the chakras, and, you know, there's total alignment and it feels like truth, right? When you get into that alignment with who you truly are, we can heed a calling. We can wake up. We can serve. And I believe, correct me if I'm wrong, that the word doctor actually means to teach in Latin, right? Mm-hmm. So, and that's what you're doing. I believe, and I'm on your team, right, that this is all about empowerment, that once we know more, we know better, we do better because we have an opportunity now to move forward. And I still find so often that people, yeah, that sounds good, but it's so expensive. And I just want to go to my doctor. And I say to some people, I said to a guy, one of my clients this week, I was trying to explain the difference between functional medicine and conventional medicine. And I summed it up in this way: you don't go to Home Depot for a haircut. You just don't do it. You're going to the wrong place. And that's, again, I know we're coming full circle back to this, but I want to be really clear because I think people, they want a quick fix. And if it's not a pill that they want to take, it's a supplement they want to take to get better. So we just, as human beings, I think it's just human nature to want the easy path out. But once people start experiencing these symptoms, that is the opportunity to dig within ourselves and really inquire why. Why is this happening? I didn't start getting on the healing path from MS until a family friend asked me, why do you think you got the MS, Palmer? Back when I was 19. And that took me more than 2 decades to figure out the why, but I never stopped asking the question. So I view symptoms as messengers, invitations, as you're saying, to wake up, to dig deeper. Because if you still have them, it just means you haven't found your root causes yet, right?
Right.
So
and I love,
please.
Could I offer something to what you just shared? So we have to remember that we only want the quick fix because that's what we've been taught to want. Yes. And that the whole way how our paradigm of life, we have been taught since we were in utero and in the hospital and born, that it's Medicine is symptom management, and amelioration of symptoms is the goal. You just want to feel better. That is the goal. And that your health insurance should pay for that. It should cost you minimal cost. So we have this paradigm that we want to spend as little as possible on our health. We put health expenditures in the expense category, and all expenses are to be minimized, right? And if our health insurance doesn't pay for it, we don't want it. And so what I really help people to understand is it's a whole paradigm shift. You know, you have to really start looking at, what do you believe the body is, and why do you believe that you're on this earth, right? If you believe that you're just a car, you're just a vehicle, and you just want it to get you from point A to point B, and if it has a problem, just squelch the problem and put minimal expenditure in it, then that's great. But the problem comes when that paradigm conflicts with what you're actually getting. And there are enough people now that are realizing, hey, I'm only getting symptom management at my doctor's office and I feel like crap, and I'm 47 years old, and I see other women 47 and 57 and 67 and 87 who are thriving. And they're strong and lean and smart and happy and have great sex drives. What is going on? Why can't I have that? And they're seeing, because people like you and me are out there saying, and they're realizing that there is a whole vast other area for them to address. And they're getting in the paradigm of, oh, I need to treat my root causes. And then the next paradigm comes up, but it's expensive and my insurance doesn't pay for it. I can't tell you. That's the first question so many women ask me. Do you take my insurance? No, I do not take your insurance, because they don't pay for you to be healthy. They're not interested in you being optimally healthy. They're interested in controlling your disease. And that's a whole other discussion that I can get into, but we won't go there. So what I help people to understand is that your health is your greatest investment, right? We think our house is our greatest investment, don't we? We redecorate, and, you know, I had a friend recently, she wanted to sell her house, so she redid the kitchen and all the bathrooms and invested all this money in it so she could get her return on investment, right? And that's all, she's all about her house, but she puts no money into all about her house. She doesn't put money into her health. But the truth is, this is your first house. The house you live in is your second house. Why do we consider expenditures on our home that is irreplaceable? We don't consider that as an investment. You can replace your house if it burns down to the ground. You can rebuild it. There are some health problems that you have that no amount of money will save your burning house, your burning body. And yet we view this as expenditures. I view all expenses that I pay for my health as investments. So I pay for functional testing, I pay for supplements, I pay for organic food, I pay for all these things. That's probably my number one expense category, actually, because I have had the wake-up call that this is my greatest investment. Yeah. So when you say it's too expensive, you're coming from the paradigm of, my body is just a car and I want to minimize expenses on it. When you come from a paradigm shift of, this is the only home you get to live in, and you're not going to get to be here anymore once it's gone, then you start realizing, oh, loving myself, loving my body, and as my greatest investment, then I get to spend the money on my greatest investment that will pay me back with infinite rewards and energy, in beauty, in self-expression, in being there for the people in my relationships, right? And the love that I'm here to share with others, and the creativity I'm here to express. So then once you have this awakening, you can make a choice. And there are some people who say, nah, I don't want that, and that's fine. It's your choice. But you're not at choice if you don't realize that you're just functioning out of a paradigm that you were trained in. So
That's right. That's right. So let's assume that this woman who's just come to you, age 47, like, Dr. Kyrin, I want all that. Mind, body, spirit, I'm in, right? She's done the assessments. She's filled out the, gazillion page intake form. Mm-hmm. She's ready to go. Talk to me, if you will, because you mentioned functional medicine testing. And I want people to have access to the best tests. And I highly recommend that people work with a functional or naturopathic doctor or an integrative physician who has a bigger toolkit like you do. Some people, want to order them on their own, and more labs are providing that. Sometimes it's difficult to interpret. So it's really important to work with a guide if you're able to do that. What do you typically like to do first? Do you order all labs at once? If she says, let's just do this, I am my greatest investment. I want to know what's going on with me under the hood. So let's take a look at this. What do you like to start with?
Right. So I usually start with a blood panel that does include a lot of the standard labs that we do as regular physicians, but also include some expanded parameters like the fasting insulin and hemoglobin A1C, an expanded thyroid profile that isn't just a TSH, thyroid stimulating hormone, but also is free and total T4, free and total T3, reverse T3, T3 uptake. I look at the thyroid antibodies. I like to look at vitamin D, and then I like to look at a lot of the inflammatory markers like homocysteine, high sensitivity CRP, ESR, ferritin, right? I like to look at, did I mention vitamin D? Yes. And then I always like to look at a complete blood count with differential. That gives us a lot of information. It can sometimes imply that you might have gut inflammation. I do the liver and kidney chemistries, which includes a fasting blood glucose. I like to look at a basic lipid profile. Sometimes I'll do a fractionated lipid profile in some people. And something I've been doing more and more with people, Palmer, is I've been doing an Epstein-Barr profile right up front, because I have to tell you, by the time someone comes to work with me, I have yet to find a person that wasn't a part of their picture. And so I kind of want to know, 95 to 100% of us have Epstein-Barr. It's just a matter of how active is it. Unfortunately, it's one of these viruses that we never get rid of. So I like to see how active it is. So I like to get the titers. And then another test that I have started doing right up front is called a natural killer cell, or also called CD57, cluster designation 57 test. That's a specific type of lymphocyte, right? You have many different types of white blood cells that fight infection. And just like with AIDS, there's a certain cluster designation or type of lymphocyte that's infected that goes down, that causes them to be susceptible to infections in a very quick, life-threatening way that now is controlled with antivirals. This cluster designation 57 similarly can start going down when you have chronic insults, whether it's Lyme or mold or Epstein-Barr or cytomegalovirus or all this plethora of infectious agents. And so I love to get that, because I find that almost all the women who work with me, by the time they come to me and they've been to, like they come to you, 10, 20 or more doctors, they really have had a time with it. And most doctors aren't familiar with these tests. So it really lets me know when I see their CD57 and it's less than 200, like we're in a real pickle here. We really have a suppressed immune system, and we really need to get on the ball. So I like to start with that general panel. Most everyone does need some form of functional stool testing, food sensitivity testing, and hormone testing. What that looks like in a particular individual depends on what they've had done before, what they haven't had done, where they are in their journey. I don't order every test. There are probably thousands of tests I could order. I don't start everyone with a heavy metal challenge, right? Because your body, it's very hard on your body to tolerate that. And so if you take a very toxic person and you give them, a chelating agent, which we usually give to provoke the heavy metals, you can make someone extremely sick. So you don't start with that.
That's right.
I don't start with Lyme testing on everyone. There are many tests that, I tell people it's like peeling an onion when you're getting to the heart of your root causes of your health. So you peel the first layer and you look and see what you've got and you address that. You peel the second layer, you look at what you've got and you address that. And I always say that health is a journey, not a destination.
I love that. I love that. And it's a practice, and
It's
it
a
requires
practice.
patience because you didn't get into these problems overnight, and we're not necessarily going to heal immediately. But there are some things that people can do to start feeling better pretty quickly. So I wonder if you could talk about, from your perspective, some of the highest leverage lifestyle shifts that people can make on their own to get started right away.
Number one, what you're eating, hands down. That you cannot supplement your way, meditate your way, exercise your way into good health without eating high quality fuel, high quality macronutrients, your carbs, your fats, your proteins, high quality micronutrients, vitamins, mineral, and other nutrients. There is no substitute. You literally are, everything that you've ever eaten is right here.
Is who you are.
It's who you are. So I don't know how anyone could think otherwise or try to tell someone otherwise. Oh yeah, you can eat junk and you can get healthy. That's a lie. You need to run the other way. You break down everything that goes in here and it becomes you. So if you eat junk, you eat poor quality, your cells are manufactured out of poor quality. It's like a building made out of cardboard and toothpicks. That's what you become when you eat poor quality. What do I mean by poor quality? I mean highly processed, meaning they've done a lot to it, right? So sausage, let's just take that. They take the animal byproducts, sometimes the least savory parts of the animal that have the least nutrient density, and they macerate it up and they put it with other low quality ingredients like wheat that has glyphosate in it. And they grind it all up and they put all kinds of artificial flavorings and colorings to make it smell good and look good and taste good, right? Because we've been trained to think that sausage that looks a certain way is good and it smells a certain way. And then you eat it, but you're eating cardboard and toothpicks. And then your body is made out of low quality. So you've got to eat high quality, primarily plant-based. I like for people to try to limit their animal protein to no more than once a day as a condiment, and primarily plant-based diet. Grains is very individual. Nobody needs to be eating inorganic wheat, period, end of story. No one, because of the glyphosate. If you can tolerate organic wheat, then there are some people who can eat it. But even so, because it's been genetically modified, it has a high inflammatory component to it. So when you're trying to decrease inflammation is the enemy. If you're eating inflammatory foods like wheat that has high density gluten in it, you're eating cow's milk, and particularly if they're inorganic, you're just throwing kindling on the fire every day and you're trying to decrease inflammation. So grains is it depends on the person. Legumes, beans, I think variety is very important. We as humans can get stuck in eating the same things all the time because our food sources have been uncoupled from our locality and our seasonality. So if we like blueberries, we're going to eat blueberries every day because we can get them from a place that can make blueberries every day. But your body doesn't like that. It was made to eat seasonally, locally, eat a little of this, eat a little of that, blueberries in season. And this is how one of the ways that we get into food sensitivities is we're constantly eating the same things over and over again. So I would say number one, Palmer, is you got to get your diet cleaned up.
Let me pause you on that for a moment, because I say the same thing, and the first chapter in my book is Start with Food. Let's say that somebody has trouble figuring out what they're sensitive to. I take them through a 30-day food vacation, which is based on the gold standard elimination diet. But not everybody can tell that cause and effect. Do you have favorite food sensitivity panels? And I know this is really a moving target because there's so many out there. Do you have one you like?
I do. I will say this about food sensitivity testing, that we don't have a perfect science. There's so many branches of our immune system, which is like our body's military. So many different ways we can react to a food, that I don't think we've gotten to the ideal food sensitivity test. There are some that will look at IgG antibodies, and they've tried to increase the sensitivity and specificity by adding a complement to that. So some of those are pretty good. There's some that are just look at cell-mediated immunity. Are the cells kind of putting out their chemicals when they come in contact with the food? So, I can mention a few, but having said that, I don't think there is one that is far and above superior, unfortunately.
Yeah.
So, the ALCAT is one of those cell-mediated immunity. There's the KBMO, there's ALA-test. Some people will do serum, they'll do blood and look for IgG and the IgE antibodies. So I think there's so many, and the reason why there's so many is because none is perfect.
None is perfect. That's right.
Yes.
That's great. So food is one area that you tell people this foundational. What other lifestyle shifts can people make to recover their health and optimize their health?
Stress. Got to look at stress. That would be number 2, because that controls your nervous system and your cortisol stress hormone. And those are the two. Remember, I talked about the root causes, hormones and nervous system. It's the autonomic nervous system and cortisol. I call it Queen Cortisol. Because she is in charge, and she will wreck your health or make it the best, right? And so you have to address stress. You've got to really start looking at saying no, not doing everything for everybody, putting yourself at the top of your to-do list, and decreasing the amount that you take on. Because I know I used to be total just type A, do everything. And now it's like, no is one of my favorite words. I'm sorry, I can't help you with that. Because you've got to cut that out. But also looking at the other places you get stress, blood sugar stress, like we talked about, the blood sugar roller coaster, got to get off of that, because that affects your cortisol and your stress from your toxicity. So we've talked a little bit about that. Meditation, breathing practices, the more you hate to do them and you can't sit still and shut your mind off, the more you need to do them.
Yeah. It's beautifully said. And that is a saying with Qigong, that if you don't think you have time for it, you actually need to do more of it. So we've got food, we've got stress reduction. I don't just say stress management. It's about reducing it wherever you can, right? Challenging your thoughts, really taking a look at those beliefs that you have that are running the show. Anything else that you like from a lifestyle perspective?
I want to add one thing to what you just said about that second part in the stress. So before I got on this journey, I thought that my to-do list ran everything, and I had to be the best wife and the best mother and the best doctor and the best business owner and best daughter and sister. And I was always running to try to meet some ideal. Yeah. And then through this journey, fast forward 10 years later, my whole life is different. Like, my health and wellness comes first. That means time in nature, time with myself, quiet time with my higher power, time with knowing my feelings, knowing my internal life, time preparing meals, taking supplements, exercising, right? So it's a whole paradigm shift that I think allows you to reduce that stress. Yes, cutting out things is part of that, but also changing the whole focus. Like, I was a human doing, and now I'm a human being who's present for her life. I used to think like something's going to happen, that someone's going to come in and say, you now get a vacation and you don't have to worry about all these things. And what I realized is I was the one I was waiting for. No, I get to make it the way I want it. And I get to take time for my life and be present for it. So it was that shift. So in answer to your question, other lifestyle things, I think exercise. Exercise wasn't one of the first things I did, because I really had chronic fatigue. And when I first looked at my cortisol, it was a flat line at the bottom, right? I was barely surviving. I didn't have a disease by mainstream medicine definition, But if you look at the functional labs, I was a flat line, which means my body had enough cortisol to kind of run the basic mechanics, but not anything else. So I didn't have the energy to exercise. I just couldn't do it. So it wasn't a part of my first 6 months. All I did is change the way I ate and addressed some of the my diet cleanup and some of the nutrient imbalances and the hormone imbalances. And my health shifted dramatically in that 6 months. So I don't say that exercise is one of the first things you have to do, particularly if you are cortisol depleted. You just can't, right? And you'll know that because you go exercise and you feel like you got hit by a Mack truck. You're out like, what happened? So if that's you, don't do it. However, once you get out of the adrenal fatigue, if you don't add proper exercise, and when I say exercise, I mean 3 things: aerobic, resistance, and flexibility. 3 things. If you don't add those, your health will never get to the level that it could get to. There's no vitamin you can take or supplement you can take to replace the benefits on your hormone balance, on your detoxification, it's just, I call it vitamin E, vitamin exercise, right? There's so many benefits that you get from it, but don't neglect any one of those parts. I see a lot of women who are all about the aerobics, but they neglect the resistance, which is weight training. And you really need that to maintain your muscle mass, which maintains your bone mass and has everything to do with your testosterone. So, and your drive in life and your dopamine. So you need that. Your DHEA. Mm-hmm. And do not neglect the flexibility, which for me is yoga. Stretching for 2 minutes before and after you work out with weights or do aerobics is not enough, right? So if we don't exercise the fascia that is around our joints, it just starts constricting more and more. Think of it like saran wrap around your joints. So every year it's getting tighter and tighter and tighter, and your mobility is going down. You don't notice it because if it happened in a minute, right? And say you went to raise your arm, say you're 30 and you raise your arm, no problem. And then you're 60 and you raise your arm and you notice the difference, right? It happens over 30 years. But that flexibility is decreasing, and that's what makes you prone when you get older to falls and breaks. So you have to constantly be stretching that fascia and the ligaments around your joints. I'm talking about like yin yoga for 5 minutes each joint, probably at least twice a week, if not more, because otherwise you lose the flexibility, which also disrupts the flow of chi. We talked about the energy flow, right? So then the energy is not flowing through your joints. It's getting caught up, and that creates stagnation and pain. And your joints start being pulled closer together, and the cartilage is rubbing harder and getting broken down, and then we have arthritis, right? So you want to keep your joints nice and flexible and loose so that the cartilage can flow freely. So don't neglect that.
Love it. Love it. Love it. So let's say that I'm that 47-year-old woman and I've changed my diet. I've added the right micronutrients back. I'm exercising as able. I'm doing my stress reduction. I'm starting my meditation practice. When is it appropriate to add bioidentical hormones into the mix?
Well, I think that's something you decide individually with your practitioner. And, it's something that I like to do is look at everybody's balance and see where they are and see how symptomatic they are and also what their personal beliefs are around that and their fears and their desires. So I think it's a very personal decision. Mm-hmm. I will say that for me, bioidentical hormone replacement has been the difference between surviving and thriving. And I feel best when I have my adequate levels of my healthy estrogens, progesterone, and testosterone and DHEA. Now, I know some other women who feel great without it. So everybody's different.
Got it. Oh, that's beautifully said. And if you want to know what they are, so I'm familiar with a couple of hormone tests. I think the Dutch test and ZRT are 2 common ones that are very popular, and Doctors Data has a Labrix set of panels. Do you like any in particular? If somebody is going to ask their doctor, please help me with my hormones, or what do you recommend?
Right. Well, I love the Dutch test, the dried urine hormone. It gives you how you're breaking down your estrogens, your testosterone. It gives you your levels. I love it. Now, only doctors who are trained in assessing a Dutch can read it.
That's right.
The average doctor can't read that, and they don't even know how to read a ZRT or a Doctor's Data or a diagnostic saliva test. So you would need a naturopath or functional practitioner for that. Your regular doctor, from what I hear from most women, is typically going to tell you what I used to tell my patients. We don't check women's hormones, which is kind of insane because we check everything else in medicine. But the ACOG, American College of Obstetricians and Gynecologists, official position on hormones is we do not check women's hormones. We do symptom treatment for hot flashes and vaginal dryness only. And we do that with synthetic hormones typically. So I have women come to me all the time and say, I asked my doctor to check my hormones. I heard your podcast and I heard you talking about it. And they told me we don't do that. And they basically laughed at me. So, you got to be in the right mental space to even have that conversation with your doctor. Now, if they are willing to do it, you could ask them to do a serum level of estriol, estradiol, estrone, the 3 types of estrogen, free and total testosterone, and progesterone, and DHEA, right? And you could even have them do a fasting cortisol in the morning. Now, what are they going to do with that? They're not going to know how to read it. They're going to read it like I used to read lab tests, which is what the lab says is normal, which is what's defined by what 95% of the population in your age group has. And we've already talked about the fact that that includes 60% of people who are overweight or obese and who are not optimally healthy. You're going to be compared to those people for your age group, say it's 47, and basically they're going to look at it and go, oh, you're normal. That's what they're going to tell you. So it's kind of pointless unless you have someone like me or Palmer, and then we can tell you, no, you want your estriol to be up at this level, and you want your progesterone to be up here. And, that's something that we can certainly help people with. But it sometimes can give you a spot check if they're at least willing to do the labs, and then you're listening to Palmer's work and podcast and reading her book, or you're listening to me, then you'll hear us talking about what it should be. And then what to do about it is another conversation.
This has been terrific. I wonder if you have any closing thoughts or words of wisdom that you'd like to leave us with today.
Sure. Well, I'd say thank you so much, Palmer, for having me. I love having the opportunity to talk to women and men who are suffering and thinking that this is their lot in life with their health and that there are no answers. And what I want you to hear very clearly, everybody watching and listening, is you deserve to have brilliant health. It is your birthright. And whatever you need to do to figure out what you need to heal, you owe it to yourself to get the information and follow the path, because it's going to lead you to not only better health and feeling at ease in your body, better energy, better sex drive, better hair, better everything, right? But it's going to lead you to the next greatest version of yourself, which is the reason why I do the work that I do, because I think that we each have unique gifts that we are meant to deliver to this world. And you can't deliver it if you're laying in your bed feeling like you were run over by a Mack truck and wondering what happened to your life. So I hope that you take some inspiration from Palmer's journey and from my journey and all her other guests, and that you really follow your intuition as to what resonates with you. What sounds right? Are you feeling like, oh, I heard that about hormones and I should get them tested? Or is toxicity ringing your bell and you think I need to know more about that? What is resonating with you? Pick it up and follow the path, because this is the call to your journey to better health and a larger life. Thank you.
The golden breadcrumbs, so to speak. I love it. Dr. Kyrin, thank you so much for your generosity, your gifts. I am so excited to be a part of your Stop the Menopause Madness Summit. And I look forward to connecting with you again really soon. This has just been a pleasure.
Thank you so much, Palmer.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.